So we're going to go over the bird dog now. It's a very common exercise that people do all the time. And I think I mentioned in the lecture, they do it wrong all the time. The way that people tend to do this exercise is they get in the right position and then they just sort of fling their arms and legs up in the air and their spine is moving all over the place. The main goal of this, similar to the ones that we've done on the floor, either lying face down or face up, is to maintain spine position or maintain certain muscles contracting. So you want to first make sure that in this position your patient understands where neutral spine is. You've already worked on this with them supine in this case usually. So now in the quadruped position, you may need to work with them a little bit, not sagging down, not rounding out. You may need to work a little bit on some proprioception, on understanding that neutral spine doesn't come from arching the thoracolumbar junction. Maybe they just need to sort of work this out in this position where they're moving their pelvis. So you'll work on work with them on finding neutral spine. Now from that position, you can then either add in transversus abdominis contraction, a little bit of a multifidus contraction, abdominal bracing, which again is just sort of contracting all the muscles at the same time. So whatever you think is most pertinent to that patient from what you found in your examination, you're going to carry that over into this position now as well as you've already done lying supine. So now from here, we're just going to build up. I'm going to have one extremity at a time. Now you can see what I'm trying to do is not keep things from moving around. Some people will arch their back more or round out. What very commonly happens when you're moving one extremity at a time is now I'm pulling this pillar away. So now there's an onus for these muscles in my trunk to keep my spine from folding over like this. So maybe they twist, they may side bend. So you're going to cue them on that and help them to not do that through some amount of muscle contraction and just control. So I go back and forth. So now I can do this. It's pretty easy for me. I feel a little bit of work happening. I'm bracing my abdomen a little bit because I may tend to flop down like that. Now the next phase is to do lower extremity. What I typically tell people, especially I'm on this rug here, so in order to keep them from rocking, to feel like they can now clear their leg, you just cue them to slide their legs straight back. The amount that they kick the leg back, again, the farther away from the midline it goes, the harder it is to control. So you can see with the upper extremity, I'm just sort of bending my elbow for now. I'm not even reaching out yet. So with the lower extremity, it might be the same thing. I just kick out enough just to unweight that lower extremity from the ground. If you want them to kick, now this requires a little bit more control. There's more of a tendency for things to move around. Same thing with the upper extremity. There's more of a tendency for things to move, but you could build out as a way of progression how far away from their body they go. Same kind of principles as when they're supine. So I can go from this to this, and then same thing in the lower extremity. I can go from this to here, and then working to doing one lower extremity and one upper extremity at a time. But you can see the number one thing is I'm trying desperately to keep my spine in the same exact position the entire time. The last thing I'll show you is you can use a roller. I'll usually use a half roll, it's a little better for this, but I don't have one. You can use a roller to give them a cue as to whether or not they're maintaining neutral spine or not. So you're going to see a little bit of a space here. This roller might not cooperate, but you're going to see a little bit of a space where they're not rolling it off by rounding out, right? So they can do all those exercises, maintaining a neutral spine and have that cue. They can use a broomstick, whatever, a plank of wood, I don't care. But it's just going to give them a little tactile cue, maintaining that little bit of extension, again, neutral spine, while they're doing all these extremity motions that you show them.